The American Counseling Association's Code of Ethics gives guidelines for professional counselors on how to properly and professionally choose assessments. It also details the importance of educating clients before, during, and after the assessment is complete. Section E of the Code of Ethics is dedicated to detailing guidelines regarding evaluation, assessment, and interpretation. Section 1 explains the foundational reasons for utilizing assessments as a tool of discovery. Professional counselors can use the qualitative and quantitative results of the assessments to learn more about their client and develop appropriate treatment plans. Additionally, the counselor is reminded that the information received in any assessment should be used for the betterment of the client and to keep the client's rights of the utmost importance. The second section details the importance of counselor competency. Professional counselors should take care only to utilize assessments of which they have been appropriately trained and educated. The counselor needs to understand the psychometric properties of each assessment they use so they can properly score, explain the outcome, and use the information to make an informed decision for the client. Section 3 and 4 detail the importance of client rights and informed consent. Professional counselors would have this information explained to their clients prior to giving an assessment to ensure the results are only released to authorized individuals. Next, Section 5 details the ethical guidelines of diagnosing based on assessments. The counselor should use a wide array of assessment resources to make an informed decision before solidifying the diagnosis. The counselor should consider cultural bias as well as a client's ability to receive a diagnostic report prior to detailing their findings. Instrument selection and administration is discussed in Sections 6 and 7. It is vital that the professional counselor understand the details of the assessment in order to properly administer it. The counselor should also take care to educate the client on the assessment and how they will be taking it. Section 8 reminds the counselor of the ethical factors of multicultural diversity when choosing an assessment. Professional counselors should take into consideration age, color, culture, gender, race, language, religion, sexual orientation, and other factors when discussing, administering, and giving the test results. Next, the interpretation of results is detailed in Section 9. Cultural background and education are considered when detailing the scores and results to prevent any misunderstandings and confusion. Section 10 details the counselor's ethical duty in maintaining the security of published assessments. These assessments should be used and given with integrity and not reproduced or altered without permission. Section 11 includes ethical considerations of outdated assessments. So professional counselors should maintain awareness of current assessments and are cautioned not to misuse obsolete assessments. Section 12 requires counselors to maintain scientific procedures and utilize their professional knowledge with regards to development, publication, and utilization of assessment techniques. The final section regarding ethical considerations with assessments details professional evaluation for legal proceedings. So the counselors should give their objective findings when detailing forensics for legal proceedings. Professional boundaries and informed consent are crucial in maintaining ethical values in a legal setting. So given these intricate details that the ACA published in their Code of Ethics, evaluations and assessment are an important aspect of counseling and requires professional awareness and an immense ethical consideration. It seems that building the therapeutic relationship is so important when utilizing evaluations and assessments so that the counselor can ensure comfortability, education, and a better understanding for their client. Maintaining ethical and professional awareness should be foundational for counselors and is certainly important when choosing and administering assessments for clients.